The month of June here in Australia is not only the start of winter, but it is also Cataract Awareness Month. And we recently sat down with Dr. Julia Starte to talk about a type of cataract that not everyone may be aware of, and that is juvenile cataract, also known as congenital cataract. Dr. Julia Starte specialises in paediatric ophthalmology, strabismus, and also adult cataract. Julia has pursued advanced training in the treatment of eye disease in premature babies and is currently a consultant for the neonatal intensive care unit at Royal Prince Alfred Hospital. She is also appointed as a consultant ophthalmologist at Children's Hospital Westmead. Julia has a long-standing passion for working with children, and with a young family of her own, Julia understands the stress that any eye problem, regardless of its severity, can place on the patient and their family. She takes a holistic and family-centred approach to her care, and we are so fortunate here at Sydney Ophthalmic Specialists to have Dr. Starte as part of our team.
So let's get straight into it, shall we?
Sounds good.
What is a cataract, and can babies get cataract?
So, look, unfortunately they can, but if we start with what is a cataract, cataract is just an opacity of the lens of the eye. So if you think of the eye like a camera, it's got a lens at the front which focuses the light onto the film at the back, and the film in this case is the retina, which sits at the back of the eye, and that's responsible for processing the image or the light that it receives and turning it into neuronal signals, which are then sent as a message down the optic nerve and to the brain, and that's essentially how we see. So if you've got a smudge or an opacity on the lens, light isn't getting into the eye and being focused well, so we can't get a clear image. So unfortunately, yes, babies can get cataract. They can get it in one eye, they can get it in both eyes, and in fact children of all ages can develop cataract. The tricky thing in babies is, of course, they can't tell us that they can't see, and the tricky thing in older children is that they're extremely resourceful, and so they won't tell you if they can't see, especially if it's out of one eye, if they've only got a cataract in one eye. Because they often won't notice. And what the brain does when you're a child is it just ignores the cloudy image or the unclear image, and it just focuses on the eye that sees well.
And are they common, Dr. Starte? What actually causes them?
So thankfully, cataracts in babies and children are not common. And if we think about cataracts in adults, a cataract in an adult is essentially a normal part of the ageing process. And the reported incidence is about 10% of the population over 65 are affected by cataracts. So by comparison, when we look at babies, for example, born with cataracts, there was a study in 2002 out of Victoria and Tasmania that reported an incidence of 2.2 cases per 10,000 live births. So it is thankfully very rare. And in terms of what causes it, look, often the cause is actually unknown, which is very frustrating for parents. So sometimes there's an underlying genetic cause, and either that can be inherited or it appears sporadically in this baby. And we're getting a lot better at being able to test for this. So now, especially if a baby presents with cataracts in both eyes, we can send off genetic testing. There's a whole panel of known genetic causes for cataract. And so our pickup rate for finding the underlying cause has actually increased, although still, in a lot of cases, we never find the underlying cause. There are a few other things that can cause cataracts in babies more rarely, and they include things like maternal infections. There are some metabolic conditions that can cause it, and some syndromes as well. So I always get a paediatrician to have a little look at these babies, because often there are other signs that we as ophthalmologists are not as good at picking up, that the paediatrician might pick up, and that might just help us piece together what's going on for this baby. The other thing I always like to do is have a look at mum and dad's eyes, because occasionally you might see a very subtle undetected cataract in either mum or dad's eyes, and this has certainly happened to me a couple of times now, where one dad springs to mind, had a very, very subtle opacity of his lens that didn't cause any problems with his vision, had never been detected before, but that gave us a really good indication that this was an underlying genetic cause. And it stopped us from needing to do a whole lot of other investigations that would have been unnecessary. And then in older children, the list gets a little bit longer. So things like trauma can cause a cataract. There are certain medications that we know cause cataract, and one of the most common ones are steroid medications. And chronic inflammation of the eye can also cause a cataract.
And Dr. Starte, how would I know if my baby had cataracts?
So this is the important message that we want to get out to parents and healthcare providers, and especially this month being Cataract Awareness Month. So when your new little baby's born, the paediatrician comes in and does a newborn check, and part of this check involves checking the eyes and, most importantly, checking for the red reflex. So the paediatrician will shine with a special torch a light through the pupil and look for the red reflex. And you've probably seen the red reflex in old photos, although iPhones are getting better and better at filtering these out. But essentially, if you take a photo with a flash, an old school photo with a flash, you can see often the red reflex through the pupil. And all that is a reflection off the healthy retina at the back of the eye. So if that's not present, either during the newborn exam or if you pick it up on a photograph, it just means that something is preventing that light from being reflected back out through the pupil. And quite often that can be a cataract. So we call that leukochoria. Leuko just means white in ancient Greek, and choria means pupil. So leukochoria essentially means that something is obstructing that reflection. And as I said, often that can be cataract, but there are other more nasty things, unfortunately, that can be as well. So if the paediatrician thinks that they can't get a clear red reflex out of one or both eyes, it's really important that they refer on to an ophthalmologist for an urgent review. Unfortunately, sometimes leukochoria can be missed during the newborn exam, and that's not because the paediatrician doesn't know what they're doing. It's because sometimes these cataracts can be really, really subtle when the baby's first born. And so there is a bit of a red reflex, but the tiny little opacity isn't picked up. And so I'd always encourage parents, if they think they've noticed something in a photo, just to follow their gut and get it checked out, because just because you've had a normal newborn check, or even a check subsequently with your GP, it doesn't mean that you don't know what you're seeing. So always get it checked out, and always get it checked out promptly. Unfortunately, there are even more nasty things than cataract that can cause a leukochoria, and one of those is retinoblastoma, and that's a cancer of the retina at the back of the eye. Now, it's a life-threatening cancer, but if it's detected quickly and treated early, the survival rates are exceptional. And so again, if something is noticed by a healthcare provider or by parents out there, make sure you get your baby checked as quickly as possible. One of the ways that cataract can also present in babies and children is a turn in the eye. And this would be another reason to go and get checked out quickly. Now, I think there's a lot of confusion out there about when to get your baby checked out or your child checked out if they've got a turn in the eye. So babies often start life in the first 2 or 3 months with eyes that turn in or out and do funny things. And all that is the baby learning how to use their eyes together and coordinate those movements. But by 4 months of age, the eyes really should be straight and be moving well together. So if they're still intermittently turning in or turning out, that is a reason to get your baby's eyes checked. Prior to that, if they're turning constantly rather than intermittently, that should also be checked. That is not normal. So once again, I encourage parents, if they've got any concerns about their baby, it's very reasonable to get checked out.
And how do congenital cataracts affect children's vision?
So this too is extremely variable, and it depends on the type of cataract. There are lots of different types of cataracts, and there's a huge range of how severely they affect the vision. So you can, as I mentioned previously, you can get cataracts that are so tiny that they actually don't cause any impairment to the vision at all. And that ranges to the really severe, dense, opaque cataracts that prevent any light from getting into the eye. So depending on how much light is getting into that eye and what sort of image is forming on the retina governs what we do about the cataract. So up until the age of 8, or approximately 8, the pathway between the eye and the brain is actually still developing. And that pathway is very plastic, which essentially means that it can be strengthened or weakened depending on how much it's being used. It's the sort of use it or lose it hypothesis. And so if you've got anything that's preventing a clear image from forming on that retina, the message that's being sent from the eye to the brain is not clear, and therefore that pathway becomes weak. And that's essentially what we call amblyopia. So this is why babies with cataract especially need to be treated for their cataract if it is visually significant early, because the younger the baby is, the more plastic and the more vulnerable that pathway is. So essentially there's a little window there in which we have an opportunity to treat the cataract and clear that visual pathway. So this is why in babies with cataract especially, it's important to treat that cataract early so that a clear image can be restored as soon as possible and that the pathway develops normally.
Now, Dr. Starte, what treatment is available for babies or children with cataracts?
So there's a few different treatments, and what we do really depends on the type of cataract and how much it's blocking light from entering the eye. Sometimes, as I said before, they're really small, and as long as we can monitor the visual development and it's not being affected, we don't really need to do anything other than just watch. Occasionally, if it's very small and very central, we can use dilating drops in the eyes just to make the pupil a bit bigger so that it allows a little bit more light to get into the eye. And occasionally we might do a bit of patching of the better eye to try and encourage that visual pathway to be used a little bit more frequently and become more strong. But often, if there's a significant impact on the vision, we really need to do an operation, and the operation that we do is called a lensectomy, which is basically just removal of the lens. So once we remove that opaque or cloudy lens, we then have to replace the focusing ability of the eye. And often, especially in little babies, the eye is too small to house what we call an intraocular lens, or a lens inside the eye. And so we use either contact lenses or glasses to replace that focusing ability of the eye, or replace the lens. Once the child's a little bit older, then, and the eye's done most of its growing, we can then revisit the option of placing a lens inside the eye, which the child then has in their eye for the rest of their life.
Now, what other long-term problems can happen for children with cataracts when they're adults, Dr. Starte?
So look, this is the conversation that I always have with parents when they first come in and their child is first diagnosed with cataract, that we are going to get to know each other very well over the years. And this is where cataracts in children are so different to adults. If grandma or grandpa go to the ophthalmologist and get their cataracts operated on, they might see their ophthalmologist once or twice over the next month while they recover, and then they're often discharged if their eye is otherwise healthy. For kids and babies, it's completely the opposite. We have a lifelong relationship because there are lots of things that can happen along the way, even if we've had a successful cataract surgery. So often, even though the cataract surgery feels like the scariest step to parents, I often describe to parents that it's really the easiest part of the whole journey. So look, some of the things that can happen along the way are obviously visual impairment, and that's the number one thing that we're looking at after the surgery, is how the vision develops once we've removed the cataract. And so there's often a lot of patching involved. Sometimes we need to adjust the strength of the contact lens or the glasses that they're wearing as the eye grows and the power of the eye changes. These kids can sometimes develop a turn in the eye, which we call strabismus, and that may require additional surgery to realign the eyes. And one of the big complications after cataract surgery that we monitor for is glaucoma. And again, this sounds like a disease of the elderly, but can occur in children, especially those who've had cataract surgery before. And glaucoma is essentially high pressure in the eye, which can cause progressive damage to the optic nerve and therefore the vision. And so if this occurs, we can treat it with drops, but occasionally, again, it requires surgery to try and lower that pressure.
And lastly, Dr. Starte, I wonder if there are any support groups available that you might be able to recommend for families with children who have been diagnosed with cataract.
Look, there are, and certainly the best one out there for kids with cataract is Cataract Kids Australia. They have a fantastic website with loads of information for parents, and I was having a little read the other day, and it's been started by a mum who had a child with cataracts and who really understands what the journey is like, and she has laid out for parents step by step what to expect along the journey, not just the surgery but all the clinic appointments and things that can arise afterwards. So I really recommend parents especially when their children are first diagnosed with cataract, to jump onto that website, because there's so many resources. And they also have some great support groups, so they can connect you with other parents who have been through it before, and often that's the best support that anyone can give.
Thank you for such an informative and comprehensive conversation about congenital cataract, Dr. Starte.
Oh, look, Amanda, it's been an absolute pleasure, and I really hope that that's been helpful to parents out there and any of our healthcare providers that are looking after these children. Thanks very much.
We'll also be sharing a couple of the resources Dr. Starte discussed on our website. If anyone listening has any further questions or concerns about congenital cataract or any other paediatric eye condition, please don't hesitate to reach out to us here at Sydney Ophthalmic Specialists. Thanks for listening.